All right, friends. Dr. Jake from VictoryHealthCenter.com here, and we're doing Max Moms, Healthy Families today. If you have any questions about who we are, what we're doing, go to VictoryHealthCenter.com, at Victory Health Center on Instagram, and there's always at least one person out there that um, I speak to your heart, and you always want to call the clinic. So there's the phone number, 865-357-2600. Not a whole lot of intro today, except for this is a very important topic for so many people and so many moms out there, moms to be, is that we're not real sure what we're going to do. Do we want to do home birth? Do we want to do shots? Um, um, do we want to do homeschool? What do we need to have a birthing plan? If we do have it at home, is it going to be in the bathtub, or we going to have to rent a tub? All these questions come about. But I think before that, um, let's enjoy the 9 months of having and making that baby, and let's make the healthiest baby that you can. It's really a miracle that you can even produce life in the first place. And for our hearts, and for me and my wife, we've lost two children in miscarriages, and so it's heartbreaking when they don't work out. And so the life of a baby is nothing short of a miracle. The whole process from conception to delivery, it's a truly amazing experience. And so let's talk about Max Moms. And so prenatal nutrition. I think that's the first thing that I get questions about, is what are the vitamins? What foods should I eat? What foods should I not eat? What do I need to avoid? We're going to cover that today. And then I deal with this a lot, and I would say that um, 75% of the women that I'm currently seeing, or that start and get pregnant, um, they have back pain. And chiropractic is really a core part of that. It's one of the most effective treatments for low back pain versus any kind of medications or physical therapies or surgeries. And we also at Victory, we do a lot of other things, as far as, like, I know that moms, a lot of times, especially as your belly gets bigger, you can't you're hungry, but you can't really eat because you get full so fast. And then we end up getting heartburn and all these other things. And chiropractic actually helps with a lot of digestive issues. And so those are the first two things that I would say. The trimesters of pregnancy is divided into, if you don't know anything about pregnancy, and I don't know a whole lot, but I do know this, is that pregnancy is divided into trimesters, and a full-term pregnancy is considered 40 weeks long. However, pregnancies can range from 37 to 42 weeks. As the baby grows and develops, the mom goes under all kinds of different changes. And so what we're going to do today is hopefully bridge the gap between what you know and what you don't know, and hopefully give you a well-balanced understanding of going into pregnancy, what it looks like, and the comforts and the discomforts. Certainly, there will be some discomforts going through this whole process. And so the first trimester consists of week 1 through weeks 12. Week 1 of pregnancy is calculated with the first day of your last menstrual cycle. So in week 1 of pregnancy, the baby has technically not been conceived yet. The first trimester consists of weeks 1 to weeks 12 of pregnancy. During the first trimester, your body is undergoing a lot of changes. Uh, so, so get ready, and it's to be getting ready. By the end of the first trimester, most of the baby's vital organs are developed due to the body's rapidly changing. Um, I would say that during the rapid changing of the body, um, these are the most common symptoms that I see at Victory: fatigue, morning sickness, trying to keep food in your stomach. I think that's so important for this one, is protein at night seems to help a lot. Ginger. The Dramamine makes an all natural motion sickness capsule, and that's certainly okay for pregnant women. Always consult your doctor before putting anything in your body, but definitely you could do that. Ginger pops, they make those, and I think they sell those at, like, Whole Foods or Trader Joe's. Cravings, of course, all kinds of crazy cravings, pickles, peanut butters, all kinds of different things. Frequent urination is a very common symptom, so don't be alarmed about that. And then do expect some weight gain or weight loss, and don't be scared to death if you do lose some weight during the first trimester of pregnancy. Second trimester of pregnancy is considered weeks 13 through 27. The second trimester is usually the most comfortable for most women. The morning sickness experience seems to diminish, and you start to feel more ready to eat like common foods that you were eating before. You're definitely going to begin to show now. Weight gain should be between 3 to 5 pounds per month. You'll have a heightened appetite for sure. You'll notice that the bottom of your belly, by your belly button, is going to start uh, to pooch out and to grow. After the first trimester and getting into the second one, your energy will increase, and you'll definitely going to start to feel the baby move or to kick. The third trimester consists of weeks 28 to weeks 40. It's the final trimester of pregnancy, so you're almost ready to meet the baby. You're going to feel a definite increased need to urinate. Most women that I know of and that I see at Victory develop heartburn during that last trimester. Feet and ankle swelling is common. Increased baby movement for sure. You're probably going to feel like you have an alien inside of you now, and fatigue. And it's okay, mama. It's okay to mama to lay down and put your feet up because that's normal. And do that because your feet are going to start swelling if you don't do that. As you know, research shows that only 5% of women actually give birth on their due date. And so due dates are calculated to 280 days or 40 weeks from the first day of the last menstrual cycle. But most women do not actually deliver on their due date. It is so important to recognize that many women, especially first time mothers, will develop well past their due date. It's completely normal and very much expected. And so thinking of the baby's birth as a time frame of a few weeks or even a month is much more advisable in regards to expectations or even exaggerations. Um, Optimal childhood health starts at conception and through pregnancy. And so you're feeding your baby directly through the umbilical cord. Providing optimal nutrients is really one of the best gifts that you can give your baby. And so moms to be need optimal nutrients: iron, folate, iodine, zinc, vitamin D, vitamin C, calcium, fiber. You need an extra 300 extra calories for sure during the final trimester. You need a supplement that, and we'll go over one in a second. That's got folate in it. Some foods that you probably want to avoid: soft cheeses made from unpasteurized milk because of listeria. You want to avoid raw cookie dough or cooked batter because of salmonella. As far as fish go, and there's different mercury and bacteria in swordfish, shark, sailfish, oysters, clams. Avoid that stuff. Unpasteurized milk for now while you're pregnant. You'll avoid that, and then raw or undercooked sprouts because of salmonella. I recommend a prenatal vitamin. This is the one that we have at Victory, but I just recommend that you get a whole food quality, organic, preferably vitamin. And so before and during pregnancy, it is absolutely critical for you or mom to be or mother to consume a variety of nutrients to support the growth of the developing baby. The one that we have specifically has omega and which is omega 3 fatty acids, osteo support to help with healthy bones, and the earlier supplementation begins the better. And so moms to be require adequate nutrient stores to meet nutrient demands for that growing baby, and so you want to be prepared. Exercise during pregnancy is totally okay. You know, it should be a priority before, during, and especially I think that a lot of moms miss the after, and it's not good for not just getting their body back, because I think that we are so look minded that we don't consider what's underneath that. And what's underneath it is your pelvis and your lumbar spine and your hips and all of that needs to get back into alignment because that actually the whole like there's an explosion of tissue and of bones that happens when you have that baby, and then you have the baby and there was something there and now it's not there, and so there was once a basketball there and the basketball is totally deflated, and so everything just sinks back and sucks back into where it should be, but it often does not, and because of um, the misalignments that happen acutely. So temporarily, what we figure if we don't exercise and we don't get back to our chiropractic adjustments, or at least get that checked to make sure that that's aligned, then you go into the next 5 or 10 years of even low back pain or weird issues like sciatica or urinary issues, you name it. So exercise is one of those things that helps you to get back in shape, and so in most cases, new research shows that exercise during pregnancy is absolutely beneficial and safe. Exercise helps to reduce weight gain during pregnancy, improves sleep, and increases energy. And according to the American Pregnancy Association, regular exercise routines done prior to pregnancy is probably safe to continue during pregnancy. And so, if you were running 5 miles before, then they say that it's okay to do that, but you are going to want to tone it down as you get more comfortable or uncomfortable with being pregnant. As far as pregnancy does go, you will be faced with decisions and birth options, and so it's advised to go ahead and start thinking about birth options right now before you even get pregnant. Some options include the traditional hospital OBGYN birth, home birth, and water birth. And the traditional birth is the most common choice in America. If you choose a hospital setting, know that a natural intervention free childbirth can be a challenge because you are in a hospital. In a hospital, access to medical interventions is not only readily available, but is highly encouraged, and most likely you will have something medical happening. Within a hospital, natural childbirth with no interventions is not the norm, but it is absolutely the exception. And so, choosing the traditional hospital setting, um, yeah, I don't. Here's the thing. I know it sounds like sometimes that um, this is just anti-hospital, but it's not. But nobody else is. I don't think is going to tell you that stuff, and so I think you need this information. Listen, if you have a child in the hospital, it dramatically increases the odds of interventions, inductions, and C sections, and so if you choose that route, it's also advised to choose a hospital with midwives who generally are more knowledgeable in natural birth if that is your choice. And you need a birthing plan, and it needs to be with you as you go into the hospital. Have your husband have that. As far as home births go, this is my very personal way. We did this at home with our last two. I have 4 kids all day, and the last two, it was amazing, an absolutely amazing experience that you just you you cannot there's something about the comfort level that happens with a midwife at your house that's just beautiful. And I do encourage this. Listen, it is totally fine to have your child in a hospital, at home in a bathtub. Um, whatever you're more comfortable with. But I'm telling you, you will feel safe and comfortable if you do it this way and you do it with a midwife. And so, the fact is that traditional hospitals, they have been generalized by the population as the normal, safe way of having babies. But home births are oftentimes not even considered as an option, but they're very safe. Um, Home births reduce the risk of those unneeded interventions that I was speaking of before. And so it could be frightening to you. But there's a lot of research out there that says that there's all kinds of benefits from immune system function to IQ and all kinds of research to having home births and the lack of the stress that comes from having a home birth. Water births are oftentimes a part of that home birth. Birthing tubs are readily available. You can get them just about anywhere. Water birth has become an increasingly more popular thing, even at hospitals, and that's because it's shown to decrease pain. And so it really provides you with a more enjoyable experience during the labor. Water birth also helps to reduce any tearing that can occur. Once you do have the baby, there's a phase that it's an exciting time. What we should do now is discuss some ways that moms can care for themselves while they are caring for their baby. And so, postpartum recovery is absolutely crucial. Living in a world with an overwhelming amount of information at our fingertips, it is so much information. Um, that it's hard to determine what is generic or unrealistic or what is truly the thing that I should be doing. And so I want to give you some really common or just solid advice here. Number one, sleep while the baby sleeps. It's a nice thought, sleeping while the baby sleeps. It sounds great, but in reality, our busy mindset often gets the best of us. The baby may only sleep for a short time, and other tasks may weigh on our minds while trying to rest, cleaning, doing the laundry, just taking care or taking the time to take care of yourself while still awake. Um, takes care of takes priority over sleep. But sleep, mama, has to become a priority. The factor that in using a way that works for you, listen, when you can, and if you can rest, if you we got to get even a babysitter, an hour a day or a couple hours a day, totally do that, and that would be totally awesome if you did that. If you really took care of yourself. And you know what? If you're married today and and your husband can afford that, then and you're at home with the baby and you can take some time to do that, then highly encourage him. Tell him to talk to me, call me. I'll tell him to do that. Postpartum exercise has a lot of benefits. Of course, after giving birth, it's critical to take care of you and take the time for you to recover from the process. Number one, it's so important to strengthen your pelvic floor. When you feel that your body is ready to exercise again, you start slowly and gradually increase intensity as you feel ready. Once you feel fully recovered, then you get into something like a high intensity interval training and go hard at it. As far as breastfeeding goes, breastfeeding has so many benefits for the health of the baby. Breast milk is considered to be the perfect food for babies due to its nutrient composition, but it also has a lot of benefits for you. You can burn extra calories and assist in your postpartum recovery and weight loss by breastfeeding. It's been shown that breastfeeding mothers need about 500 additional calories per throughout the day. Dude, why is that? That's because it uses up calories, but also it's helping your baby get the perfect food. Breastfeeding also helps the uterus to contract after its expansion through pregnancy, and it helps to reduce blood loss through following the delivery. Some women have a difficulty with their breast milk supply, and so if that's the case, there are some natural remedies that you can use to help you increase your breast milk supply. And so this is all published data, by the way. Go into the chiropractor, having your upper back and your lower neck manipulated. Those are the nerves that feed into the tissue into the breast. Drinking fenugreek tea, incorporating fennel into your diet, and also garlic into your diet. As babies grow and develop, the responsibility of the mother is to care for their child, and it's so evident. And so, as moms care for their growing child, it's critically important to take the time to continue to care for yourself. Once again, go to the chiropractor, get adjusted. This is so important. The understanding that the brain is connected to your body, and the body is where all the life is. But you live in your brain. And so all of your experience happens from that neurology that happens inside of your brain. And so you want to keep that healthy, but also keeping the connection between your brain and your body healthy. And that happens at the spinal cord and at the nervous system. And so this is just a good solid picture of what the spine should look like. It should be a C-shaped curve right here, a curve there, and a curve in the lower back. And when you don't have that curve in your neck, what we see so many times in people today using their phones and on computers all the time is we start to see this rot that happens because of the misalignment or what's called subluxation. And if you have damage to your nervous system, you're going to have damage inside of your body. Daily essentials for women, just in general, having a good solid multivitamin for daily health, because you're not probably eating all the food that you're supposed to be eating, and so you need to have like um, a good nutrients moving forward, um, especially postpartum. And then this is like a bundle that we have at the clinic. You don't have to buy all these together, but it's a general recommendation for women's hormone balance, max collagen. That when we started supplementing collagen at Victory, it made a big difference in the way that a lot of people's joints felt and that the people's skin looked. And then there's a supplement also that we have called urinary tract health. We have prenatal health perspectives at Victory, and so if you have any questions about anything like that, you can always just ask us at Victory, and we'll get those for you. And just a couple things, upcoming opportunities. If you ever have any questions about who we are, what we do, go to victoryhealthcenter.com. We have workshops all the time at Victory, and online, go to victoryworkshops.com. And then we have a radio show. It's called Victory Health Radio. And so love you guys. Have a great week. And this has been Mom's Health.